However, President Trump returning from Paris with a packed agenda. He celebrated Bastille Day this morning with French President Emmanuel Macron. Now he's turning his attention to fight to repeal and replace Obamacare. President Trump tweeted this out this morning, saying Republican senators are working hard to get their failed Obamacare replacement approved. I will be at my desk, pen in hand. After all of these years of suffering through Obamacare, Republican senators must come through, as they have promised. Joining me right now to talk more about this is Counsel to the President, Kellyanne Conway. Kellyanne, it's good to see you. Always a pleasure.
Good morning, Maria. Thank you.
So it's amazing to me to see the House went at it twice. They finally came out with a bill. They passed it on to the Senate. What does the Senate do? Rip it up and start again instead of just voting on the House's bill. What is the President doing about all of this, division within the House and Senate?
We don't look at it as division. We look at it as cooperation and negotiation.
Okay.
And it's all being done without Democrats. Not a single one will come to the table, Maria. The Democrats have come up with two big ideas on health care reform, even though so many of them have admitted that it's flawed and it needs to be fixed, and there are many Americans who are suffering and remain uninsured and can't meet the cost of these premiums and deductibles. What are the Democrats' two ideas? Number one, bail out the insurance companies. That's not plausible, and even if it were, it's a temporary fix. Number two, do just a total federal government takeover of health care. That also does not have support among the public, let alone in the Senate. So Republicans are working on this. All the principles are still there, though, to allow people to expand the contributions to health savings accounts, and for the first time ever, to allow you to use that HSA money to meet the cost of premiums. We hear from people all the time that, they had this insurance card and it was the worst possible outcome for them because the government looks at them as, quote, insured, and they can't use the card. They simply can't access the system because the premiums are too expensive. In addition, this new bill, of course, would add a number of stability fund measures. One is an additional $70 billion on top of what's already there. We want some state flexibility to let these governors decide how the monies are spent because they know their populations best. There's $45 billion for opioids. And I think all the free market competition, making sure that the 1,300 plus counties that have one insurer, which is no choice at all, making sure that the 83 insurers who have pulled out of the Obamacare exchanges, with 24 more promising to do so next year, feel like this market is still more stable. They can go back in and start selling their policies. And of course, Ted Cruz's amendment made it in there as well with the intent to help cover more Americans.
Yeah, no, for sure. I mean, look, you're seeing an effort to try to come together, but then you've got also this feeling that we wanted a repeal, we're not getting a repeal. That's what Senator Rand Paul is saying. He came on the show yesterday basically saying, look, I'm a no. I'm not going to go in this spiraling down death spiral of Obamacare where this bill out of the Senate still has taxes in it, still has subsidies in it, still has major big government in it. So if this doesn't come to the floor for a vote in the Senate, Kellyanne, is there a feeling that they could just let it fail, let Obamacare implode like it is doing already, and then just move on to tax reform? Or truly you will not be able to get to tax reform without getting something done on health care?
Look, all options are on the table, Maria, but remember, this is not just a campaign promise. It's a moral imperative. We're talking about the millions of Americans who are suffering. What about the 6.5 million who in 2015 decided to fork over money to the IRS through taxes and penalties rather than enter this wonderful system called Obamacare not? So I really think that even though people don't feel like it's full repeal or it's exactly perfectly what they would want, the fact is Vice President Pence, who's been just spectacular on Capitol Hill working with the Republican senators there, he puts it best when he says this is the beginning of the end of Obamacare. This is a 7.5-year sinking battleship that is going to turn around slowly. But we've got to start chipping away at it because there are people suffering. I mean, look at the CBO projections that 23, 24, 25 million people would be affected. It's more like 10 million. 18 million people would have coverage. Right now, it's more like 10 or 11 million. So we know people are out there suffering. We know this has been a huge impediment to small business formation and survival and prosperity. And we know there are many people in this country who do not get, like you and I do, employer-sponsored benefits, do not get government-sponsored benefits. Those millions of people, the hairdressers, the plumbers, the carpenters, the self-employed, they've been totally cut out of the system because it's too expensive and it's too top-down.
Yeah.
So we want to make sure that those people have access to coverage. Is it perfect? No, I'm one who doesn't think you can put the perfect before the good, because to do nothing means that people still suffer under Obamacare, and these insurers have no faith in the exchanges. 19 of the 23 Obamacare co-ops have failed. These websites were a joke.
Yeah.
The coverage is not real. So we really want to make sure that people always understand what we're solving for here. What is the problem we're solving here? The problem we're solving for here is Obamacare.